Hello, listeners. This is Dr. Adam Wilson. I'm delighted to begin this journey of anatomy with you. Welcome to the introduction. To begin, I want to share with you a simple definition that describes the discipline of anatomy. Anatomy is the study of how the body is organized and structured. The term anatome, from which anatomy is derived, means to cut up or to take apart. Anatomy has been said to be the cornerstone of medicine. Historically, a cornerstone, as illustrated in the image, was the first stone set by a mason. It determined the placement of the stones to follow and subsequently the position of the entire structure being built. And so in thinking of anatomy as a cornerstone, it forms the basis for the practice of medicine, and it forms the basis for all of your coursework yet to come. The list below is meant to give you a flavor of the many medical specialties that rely heavily on the foundation of anatomy. For example, surgery, radiology, and OBGYN rely heavily on anatomical knowledge for their practice. As you will soon come to appreciate, learning anatomy is like learning a new language. To communicate in medicine requires a basic understanding of anatomical and medical nomenclature. While you will use this type of nomenclature to communicate with colleagues, you are likely to use more colloquial terminology when communicating with patients. To communicate the relationships of structures and organs, anatomists have agreed upon the use of the same terms of position and direction. The terms are based on the anatomical position and can be applied regardless of the actual posture or position the patient is in. To the left of the screen, this patient is demonstrating the anatomical position. Notice how the body is erect, the arms are positioned to the side, and the palms, head, and toes are all facing forward. The midline of the body is an imaginary line that runs from the head to the toes in the center of the body. Structures that are closer to the midline than to the sides of the body are said to be more medially positioned. For example, the eyes are considered to be medial to the ears. Conversely, lateral is a term that describes the structures positioned away from the midline. The shoulders are lateral to the sternum or the breastbone, for example. Structures closer to the top of the head are said to be superior, and structures closer to the soles of the feet are inferior. Cranial versus caudal might be another term you hear when describing quadrupeds specifically. Here's an example. The eyebrows would be superior to the eyes because they are positioned just above the eyes. And the chin is inferior to the mouth because it is positioned just below the mouth. Proximal versus distal are used to describe the relationship of structures on the limbs. A structure that is proximal is closer to the point of origin, in this case, closer to the trunk of the body. The elbow is proximal to the wrist, for example, whereas the phalanges, which are the fingers, would be distal to the wrist because they are farther away from the trunk. The term anterior means toward the front of the body, and posterior means towards the back of the body. The nose, in addition to being medial to the ears, is also anterior to the ears because it is positioned in front of them. Lastly, structures that are deep are positioned closer to the center or the core of the body than structures that are considered to be superficial, which lie closer to the surface of the body. One last example would be the brain. The brain sits deep to the cranium because it's closer to the core of the body than it would be closer to the surface. Eventually, you may be called upon to position a patient in a certain way, whether it's to perform a procedure or to get a better approach to the assessment of a patient. Here are some of the most common ways to position a patient. Someone in the supine position is lying on his or her back with their face upward. Someone in the prone position is lying face down. In lab, because our first dissection is in the thorax, all of your first patients, which are your cadavers, will be lying in the supine position. The lateral recumbent position means that a patient is lying on his or her side. The right lateral recumbent means they're lying on their right side. A person in the Fowler's position is sitting either straight up or leaning slightly backwards. Their legs may be either straight or bent. A high Fowler's position is someone who is sitting upright. So as you are sitting in your seat listening to this lecture recording, you are demonstrating the high Fowler position. If one's head is slightly elevated from a supine position, that is considered to be a low Fowler's position. And then lastly, a person in the Trendelenburg position is lying supine with his or her head slightly lower than their feet by about 15 to 30 degrees. In some abdominal and gynecologic surgeries, the Trendelenburg position can be useful because it uses gravity to help move the intestines out of the way of the pelvis, for example. Now I want to take a moment to describe some of the terms of movement. Let's start here with the forearm. If we look at the forearm in full extension, when the forearm moves to about a 90-degree angle relative to the elbow, that would be an example of flexion. In general, flexion means that we are bending a joint to reduce the angle of the joint. Extension would be in the opposite direction, in which we are taking the forearm at the elbow joint from the flexed position into the extended position. So in this instance, we're bringing it back to about 180 degrees as compared to 90 degrees in flexion. When we flex our arm, we are moving it forward away from its neutral position. And then when we extend our arm, we're moving it away from its flexed position and perhaps even beyond its neutral position. That's an example of extension. If we look at the thigh, it is very similar to the arm. To flex the thigh means that we move it forward away from its neutral position. And to extend the thigh means we're moving it back from its flexed position or even beyond its neutral position. Flexion and extension of the leg are relative to the knee joint. So flexion of the leg means that we are decreasing the angle between the leg and the thigh, whereas extension of the leg means that we are increasing that angle back to the neutral position. If after a theatrical performance you take a bow on stage, you would be demonstrating flexion of the trunk or the vertebral column. Extension would be taking the trunk back up to the neutral position, and then hyperextension in this case would be taking the vertebral column beyond its neutral position to do a back bend, for example. You can think of flexion and extension of the head as being the same as the trunk or of the vertebral column. And lastly, in regards to the foot, we call this plantar flexion versus dorsiflexion. Whenever you stand on your tippy toes, you're demonstrating plantar flexion. And if you point your toes high into the air, you're demonstrating dorsiflexion. Let's take a look at a few more terms of movement. If I flap my arms like a bird, I'm demonstrating both abduction and adduction. The term abduction means to move one's limb further away from the midline. Think about it this way. If a child is abducted, the child is taken away from their parents. Well, the same with abduction. In this case, the upper limb is taken away from the midline. Adduction, sometimes referred to as adduction so as not to confuse the two terms, means to bring the upper limb back closer to the midline. The term medial rotation of a limb involves the turning of a limb inward from the anatomical position. So if we look at the foot as our point of reference, to medially or internally rotate the foot means that you're taking your great toe and moving it inward toward the midline. The opposite of medial rotation is lateral rotation, in which case the great toe would then move outward further away from the midline. That would be an example of medial and lateral rotation of the lower limb. The same is true with the head. If you take your chin and rotate it away from the midline, you would be laterally rotating your head. Whereas when you bring your chin back toward the midline, that would be an example of medial rotation or internal rotation of the head. The hands and forearm can be either supinated or pronated. Supination is the rotation of the forearm so that the palms are facing upward. Think of holding a bowl of soup in your hands for supination. During pronation, the forearm rotates so that the palm is facing downward, or facing posteriorly if you're thinking about the palms in the anatomical position. Protraction of the mandible means to move the mandible forward, whereas retraction of the mandible means to move it backwards. Similarly, with elevation and depression, to elevate the mandible means to move it upwards, and to depress it means to move it downwards. So when you're chewing, you're using a combination of elevation, depression, protraction, and retraction of the mandible. And the last term on this page to point out would be the term opposition. Opposition means you're taking the thumb and you are making a connection between the thumb and all of your other fingers. Lastly, let's take a look at the anatomical planes and how you use these planes in clinical medicine. The median plane, also called the mid-sagittal plane, is a vertical plane that passes longitudinally through the body, dividing the body into a left and right half. As an aside, the word sagittal is derived from the Latin word sagitta, meaning arrow. So if you picture an arrow piercing the body from front to back, the arrow would be within the sagittal plane. A parasagittal plane is a sagittal plane that is not in the midline of the body. For example, if I drew a line through or near the bra strap of this individual, this would represent a parasagittal plane. On X-ray images and CTs, a sagittal section allows you to view the internal organs from the side. So here's an example of a sagittal X-ray, also called a lateral X-ray. Notice the vertebral column here in the back, so that would be posterior, and this here would represent the anterior aspect of the thoracic cavity. Here also is a CT image. Again, we have the vertebral column along the posterior side of the body, and then here's the abdomen, specifically the abdominal muscles, along the anterior side of the body. The coronal or frontal plane passes through the body vertically, dividing it into an anterior and posterior half. This is the most common angle by which to view a chest X-ray. On the far right is a CT image demonstrating how you can visualize abdominal structures from this particular angle. Here, for example, is the liver, and above it, we see the heart within the thoracic cavity. A transverse or horizontal plane passes through the body, dividing it into superior and inferior parts. CT scanners, which are computed tomography scanners, are capable of viewing organs in multiple planes. However, the most common way to read a CT image is from the transverse plane, sometimes referred to as the axial plane. You will always interpret a CT image as if you were standing at the feet of the patient, peering superiorly into his or her organs. Let's look at an example. Is the X on the left kidney or the right kidney? The X is on this patient's right kidney because the patient is lying in the supine position, and if you look upwards from their feet, you'd be seeing the kidney here on the right. Thanks for watching the introduction. There are many more videos to come. If you have questions, please feel free to email me at adam_wilson@rush.edu, or feel free to swing by my office in the Armour Academic Center in Suite 505A. Until next time, take care.